So we're going to do work on a little bit of some capsular stretches with the band. We really find the band's effective at getting some of these gummed up hips moving a little bit better into extension. So what Anne's going to do is you're going to attach that to something that's very stationary. You're going to put it up as high as you can stand in your hip without hitting anything that's too tender. Then what Anne's going to do is she's going to walk ahead till she gets some good tension on it. And then she's going to go down into a lunging position with that tension on there. Often if you can get something to keep you from sliding back, most of you won't be as light as Anne, so it won't be an issue. So what Anne's going to do is she's going to fire her glute and put that into a little bit of extension while the elastic's putting a posterior glide on her capsule. Then she's going to bounce around into the corners a little bit, just like that. And that's going to really help Anne control her extension and get a little bit better movement in through her hip. So what I would do is I'd spend about 2 minutes in here, finding the corners. You're going to bounce in and out of it. Again, you want to really work on keeping your back flat, which Anne is doing a fantastic job of, firing your glute and moving in and out. So that helps a lot with hip extension. And then from here, you can almost go right into a little bit of a hip flexion mode. So what happens, Anne's going to let it come back a little bit. She's going to flex at the hip. And she's going to put a little bit of weight through her knee, and that weight through her knee is going to push her femur out the back a little bit in conjunction with the pull from the elastic. Then what she's going to do is she's going to slide out a little bit and find those corners. This is fantastic for increasing your hip flexion. A lot of people with psoas problems lack hip flexion, and to get into that hip flexion, they're overwork their hip flexors, and they get a lot of tight hip flexors. So if you can increase this hip flexion, it's fantastic, and that's, yeah. And Anne's doing a good job of that. So once you get really good at this, you can also bias a little bit of internal rotation in the hip. So turn that foot out a little bit while you're doing it. And see how she really gets in there. It's going to be an achy, kind of gross feeling when you're stretching that capsule. And don't be surprised if you're sore for a day or two after because you've broken up a little scar tissue in there. That's fine. As long as you don't have acute pain or you're not sore for more than 48 hours, then I would continue doing it. But this is going to stretch you in ways that you're not used to being stretched. So.